Sometimes vision fades quietly and without pain. It happens gradually, one optic nerve fiber at a time. The cause is increased pressure inside the eye, the disease called glaucoma. Most people with early glaucoma can still read, drive, and live normally because the brain feels the missing parts of the image. They don't notice they are losing the edges of the vision. The illusion of normal vision is dangerous because by the time people notice there is problem, about 50% of the nerve fibers are already destroyed. That's why it's important to check eye pressure regularly, know the risk factors for glaucoma, and understand how to prevent and treat it early. Our eye is fluid-filled sphere, and it must stay firm to keep its shape and focus light properly. If the eye were soft or collapsed, vision would be blurred with every heartbeat. That's why the pressure inside the eye must be maintained. Normal eye pressure is about 10 to 21 millimeter mercury in most adults, and this level is healthy. A small tissue behind the iris, called the ciliary body, produces a clear fluid known as aqueous humor. This fluid is important because it maintains the eye shape and provides nutrients and oxygen to the inner structure, such as lens and cornea, which don't have their own blood supply. The fluid inside the eye drains through two main pathways. The first is trabecular pathway. It includes mesh-like structure called trabecular meshwork, which drains the fluid into Schliemann's channel and then into the eye veins. The second is uveoscleral pathway. In this route, the fluid passes between the ciliary muscle fibers and exists through the sclera, white part of the eye, also reaching the veins. The problem occurs when fluid production increases and drainage decreases. This creates imbalance between fluid formation and outflow. Over time, the trabecular mesh, which removes most of the fluid, becomes blocked by pigment particles, inflammatory cells, blood, or age-related stiffness. Sometimes the iris moves forward, narrowing or blocking the drainage angle. This is called angle closure glaucoma. Different factors can cause these drainage problems, leading to increased pressure inside the eye, known as intraocular hypertension. If this eye pressure continues, it can damage the optic nerve, the disease known as glaucoma. Glaucoma occurs when the optic nerve starts to get damaged, because high pressure alone is not yet the disease. But if the same pressure continues long enough to compress and starve the optic nerve fibers, then glaucoma develops. Glaucoma usually develops slowly and silently because the optic nerve fibers die gradually, one by one, without causing pain or visible inflammation. The early stage has almost no symptoms. People see normally when they're looking straight ahead because brain feels the missing side part of the image. This illusion hides the problem. The first signs that appear if you pay close attention are very subtle. Sometimes people notice difficulty seeing in dim light, trouble walking at night, or bumping into objects on the side. Some describes it as poor sight vision or like looking through a tunnel. In advanced cases, even recognizing faces or reading road signs becomes harder, not because the center is blurry, but because the edges disappear. Only a small minority, those with acute angle closure glaucoma, have sudden severe pain, nausea, halos around light, and red eye. That's an emergency type and not common one. Glaucoma can occur at any age, but it is strongly age-related. In people under 40, it's very rare, seen 0.5% of cases. Between the ages of 40 to 50, it affects around 2% of population. After 60, the risk increases sharply, sometimes up to 10 times higher. Overall, about 4% of adults over 40 have some form of glaucoma, and around half of them are unaware of it. The first and most important risk factor for glaucoma is age, because as we age, the drainage channels of the eye becomes less efficient and blood flow to the optic nerve gradually weakens. This combination makes the eye more sensitive to pressure. The second most common factor is family history. If one parent has glaucoma, your risk is 10 times higher, because genetic variations can affect both structure and drainage system of trabecular meshwork and the resilience of the optic nerve fibers. The third major factor is high intraocular pressure. It is a direct mechanical cause of optic nerve damage, because prolonged compression reduces blood flow and oxygen supply to the optic nerve head, also called optic disc. This slow lack of oxygen and nutrient kills nerve fibers one by one. Another factor is thin cornea, especially if it's below 520 micrometers in thickness, because thin cornea tends to underestimate the true eye pressure during measurement, and they are also structurally weakened, offering less support to the eyeball. Diabetes is another important factor and association, because poor microcirculation and small vessel disease makes the optic nerve more vulnerable even at moderate pressure levels. Diabetes also increases oxidative stress and inflammation, further damage nerve fiber. Myopia, nearsightedness is a strong risk factor as well, because elongated eyeballs stretch and thin the retina and optic nerve tissue, making them more sensitive to pressure. In people with moderate or high myopia, glaucoma tends to appear earlier and progress faster. Long-term steroid use is another important major factor. This includes eye drops, inhalers, nasal sprays, skin creams, and even oral steroids, because steroids reduce flexibility of the trabecular meshwork and slow down aqueous humor drainage, causing the pressure to rise gradually. This side effect can appear within months and sometimes after years of continuous use of high dosage of steroids. Screen time and energy drinks can both affect eye pressure. Caffeine rises intraocular pressure around 2 to 4 millimeters mercury and may reduce blood flow to optic nerve. Prolonged screen use is also a problem. When we focus too long, we blink less and eye fluid exchange slows down. This can make the aqueous humor circulation less effective and may slightly increase pressure inside the eye. Tight collars, neckties, or upside down exercises can also raise episcleral venous pressure by blocking venous drainage from the head. This slow fluid outflow and can rise eye pressure temporarily. A single short episode is harmless, but repeated strain over years can reduce the elasticity of the drainage system. Smoking is another important risk factor. It causes blood vessel constriction and increases oxidative stress, which can damage the optic nerve. Chronic alcohol use and poor nutrition can also harm the eye, because vitamin deficiencies and oxidative damage weaken the nerve cells. Studies show that medical professionals, especially doctors, have 2 to 3 times higher risk of glaucoma, likely due to stress, screen time, and lifestyle factors. The diagnosis of glaucoma requires both structural damage to the optic nerve and functional loss of vision, not just elevation of eye pressure. Diagnosis includes three main components. First, elevated or unstable intraocular pressure, usually above 21 millimeter of mercury. Second, changes in the optic nerve head, which can be seen during ophthalmoscopic exam or through imaging tests. And three, visual field loss, confirmed by visual field test, perimetry. Glaucoma screening is recommended after 40, every 2 to 4 years for the general population. For people who use corticosteroids for long term, especially with high doses, eye pressure measurement, tonometry, should be done every 6 to 12 months. Ophthalmoscopy examines the optic nerve head. Visual field testing detects peripheral vision loss, and optical coherence tomography can detect microscopic nerve fiber loss, sometimes years before symptoms appear. The main goal of treatment is to reduce intraocular pressure. First-line treatment includes eye drops, prostaglandin analogs, which increase fluid drainage through the uvascleral pathway. Beta blockers such as timolol and betaxolol, which reduce aqueous humor production, and alpha-adrenergic agonists, which both decrease fluid production and increase outflow. Laser treatment is effective, such as selective laser trabeculoplasty. It improves trabecular drainage and can lower eye pressure around 30%. The effect usually lasts 3 to 5 years and can be repeated. It's commonly used in first-line treatment or adjunctive treatment alongside the eye drops. If medications and laser are not enough, surgery may be needed. Trabeculotomy creates new drainage channel, and microinvasive implants, they help maintain fluid outflow. These procedures can preserve vision for years, but regular follow-up every 6 months is essential.